Most of us have had some kind of back pain. One wrong move and then you could be in a lot of trouble.
And you know right away. And some people have suffered from back pain for years and years, and despite their best efforts, they still haven't found relief.
Dr. Tom Brooks is a pain medicine specialist and comes to us from UNMC Pain Medicine Clinic. Good to see you, doctor.
And you specialize in relieving back pain.
Correct.
So that's why we wanted you to come to tackle this for us.
But there's some patients out there, you know, I've gone through lower back pain. Mary's had some back pain more recently than me. But what do you tell patients who just can't seem to find any relief?
First of all, back pain is exceedingly common. 8 out of 10 patients are going to have back pain sometime during their life. It is so common, there's an economic impact from lost productivity. And what I tell most of my patients is there's hope. There's hope we can do something for them.
And we'll cover a couple of those options here as we go along through the conversation. Does it matter if maybe you hurt your back exercising, which you hear, or maybe you pick your kids up or something like that, and yard work, or if it's a chronic issue? Does the approach vary based on how long you've had the pain or what caused it?
Certainly, there is a difference in approach. If you have a brief injury, certainly you need to contact your primary care physician. Some pain needs to be treated medically early, but in truth, most pain gets better on its own, given a little time, a little rest, ice, nonsteroidal anti-inflammatory medications like ibuprofen. Those are all very helpful, but it may take 2 to 3 weeks to really get you over the event. Beyond 2 to 3 weeks, if you're still having pain, you probably need to see a pain physician.
Yeah, and sometimes it can be really rough. I know you went through that patch. I had a kind of an upper back issue that lasted, I mean, I was in some serious pain.
You couldn't move.
And I don't know how I did it, but what are some of the most common causes of back pain?
Most common causes of back pain frequently are muscles, nerves, joints, and it varies from person to person in terms of the event. And the most common in my practice is probably the facet joints.
Yeah, we wanted to ask you about
So we
the
see it on
facets.
the left side of the image we're looking at now. Would you explain why that joint is so critical?
The facet joints are the small joints of the spine. They permit motion. They allow you to bend and twist. And as you age, or as the spine degenerates, those joints pick up added stress and become arthritic and become painful.
So what can be done about the pain that comes from the facet joints?
Just like any other arthritic joint, facet joints respond to injections of small amounts of medication.
Is this the same thing as the epidural injection, which I've got friends and family who swear by it? Is it the same?
An epidural injection is used to treat nerve pain. So nerve pain of the arm or nerve pain of the leg, that's where the epidural injections really come in.
Yeah, these epidural injections, how long do the injections last? I mean, how long will it relieve pain?
Injections vary from person to person, typically, just like anything in medicine. But they have the potential to get lasting effect, months, years. But more importantly, they act as a tool for the physician to understand the patient's pain generators. So if the patient just gets short-term relief, it still provides us information, and then it allows us to use other tools that are available at minimally invasive techniques that we use at the UNMC Pain Clinic to get longer lasting effect.
That makes me wonder, are the days of surgery where you're in the hospital, you spend weeks recovering, and maybe you're never the same, are those days over, or is there still a place?
Probably depends on how old you are as well.
Not exactly. I mean,
Let's leave it to the doctor.
I'm going to let him do it.
Okay.
not exactly.
He's trying to be
Certainly,
so diplomatic with you.
some people still need surgery.
Yeah.
Our job at the UNMC Pain Clinic is to keep the people out of surgery. We use a combination of non-invasive or minimally invasive techniques to get pain reduction, increased function, and get people back to their lives.
And isn't that the key when patients come into you and you know how much this pain is affecting their lives? They can't play with their kids or their grandkids anymore. might not be able to work or do the things that they enjoy. This is really about quality of life at the end of the day, isn't it?
Correct.
Yeah, making a big difference. This is the website for UNMC physicians, and we wanted to make sure that you knew exactly where to go to learn about the pain clinic. Village Point, is that your location?
I'm at Village Point, and I'm also at main campus.
Good to know. So this is the website you're looking for, and we'll also link this back to our website, OmahaMorningBlend.com. If you'd like to, once the clip is up online, you'll be able to one click and get straight to the website to learn more about the pain clinic at Village Point, but UNMC physicians, a couple of locations here in the Omaha area. Dr. Brooks, it's nice to have you on the Morning Blend. We appreciate your time.
Thank you
Thanks,
for
Doc.
inviting
Thank you.
me.
Yeah, thanks for the information.
So now you know where to find UNMC. Here's where you'll find us. It's OmahaMorningBlend.com. We try to link back to all of our guests where possible because we know sometimes when you're making eggs and you're doing the thing in the morning, it's hard to jot it all down. So that's why we try to link to it right there on our website.